my name is Olivia Jackson. I'm here. I'm going to perform a head to toe on my patient.
Hi, Whitney.
And first, I'm going to begin by scanning the room. It's been 1 minute. Okay. Now, patient skin. I'm gonna start by assessing the skin. The color is brown. The temperature is warm. It's dry. The color is normal, meaning she's well hydrated. No lesions, no scars, no bruising, no edema. The hair is distributed even throughout the arms. I'm gonna move on looking at the head and the facial shape. The head is in the midline position of the body. It's normal size for the body. It is symmetrical. And with the body alignment, the hair, I'm going to inspect the hair. It is well distributed throughout the head. If the color is brown, the texture is fine. How does that for you?
Great.
No indentations, no infestations, no masses noted, no tenderness noted, no no indentations noted, and no depressions. All right, I'm going to move on and I'm going to palpate the TMJ. I'm going to ask the patient to clench her jaws. All right. Once you clench your jaws, no crepatitis or subluxation or tenderness is heard. Now I'm going to move on to palpating the temporal arteries. I'm going. Let me know if you feel any masses or tenderness. Now I'm going to palpate the submantle, submandibular, the pre-auricular, post-auricular. Post-clavicular, and the anterior clavicular. I'm sorry. This is the pre-auricular and the post-auricular, the occipital, and the temporal, and the tonsillars, the subclavicular. All right, and now I'm going to move on, and I want to assess the patient ears. Cranial nerve 5, I'm sorry, which is the motor nerve. I will ask the patient also again to clench her jaws. And when she clenches her jaws, no crepatitis or tenderness is heard. I'll move on to the sensory. I will ask you, let me know when you feel it.
Forehead, cheek, chin, cheek, nose.
All right, sensory motor cranial nerve 5 is intact. Cranial nerve 7, it will perform some facial expressions. Smile for me. Frown. Look at the camera for me. Okay, pucker your cheeks out. Puff your cheeks out. Pucker your lips. I'm sorry, and raise your eyebrows. All right, and the face is symmetrical on both sides. Now we're going to look at the ears. When I'm looking at the ears, I'm assessing, making sure they are symmetrical. And I'm looking at the shape. They are normal size and shape for the patient's head and body. Now we're gonna palpate the pinna and the tragus for pain. No pain or tenderness is noted. You don't feel any pain or tenderness,
No.
right? All right. Now I'm gonna move on. I'm gonna assess the auditory canal. When assessing the auditory canal, I'm using the otoscope. I'm gonna hold the ear in an upright position, back and in an upright position. Tympanic membrane is pearly gray. Tympanic membrane is pearly gray. No serum or discharge is noted. Now I'm going to assess the hearing, and this is cranial nerve 8. I'm going to perform the whisper test. Plug your right ear for. Repeat after me.
99.
Left ear.
99.
All right. Hearing is good. Okay, now we're going to perform the Weber test. Let me know when you hear it, if you can hear it. Okay. That's lateralization. She can hear it in her right and left ear. We're gonna move on to air conduction over bone conduction. Let me know when it stops.
It stopped.
It's the Renee test.
It stopped.
Vibration is longer in the front of the ear, anterior part of the ear. I'm sorry.
It stopped. It stopped.
All right. Now I'm going to move on, and I'm going to assess the eyes. When assessing the eyes, inspecting the sides. I'm looking at the eyebrows, the eyelashes in the upright position. Papillated fistulus are normal. The eyes are symmetrical. The shape is normal for the body size. I'm going to look at the conjunctiva and the sclera. I'm sorry.
Okay.
Conjunctiva is white. I mean the sclera is white. And the conjunctiva is pink. And no drainage is noted. Now I'm going to assess visual acuity. When assessing visual acuity, I will ask the patient to follow my hand, and we're going to assess the central and the peripheral vision. Cover your right eye for me. Let me know when you see it coming in.
See it.
And we're assessing the 6 cardinal fields.
See it. See it. See it.
All right. Left eye.
See it. See it. See it. See it. See it. See it.
All right. That central and peripheral vision is intact. We'll check the visual acuity. Can you read this bottom line for me? Cover your right eye.
PEZOLCFTD.
Okay. Left eye.
PEZOLCFTD.
All right. Visual acuity is 20/20. Now I'm going to assess cranial nerve 3, and I will assess the convergence and combination of the pupils response. Cranial nerve 2 and 3. We on 3. All right. I'm going to ask you to look at the wall and then gaze back in towards this pen light as I move in. All right. All right. Cranial nerve 3 is intact. Cranial nerve 2, cranial nerve 3, 2, 3, and 6. Also, you're checking the extraocular motor nerves of the pupils. And you will flash a light in. Okay, and you can assess the patient pupil sizes when when the light comes in. They restrict and dilate back to normal size. The pupils are at least a 3 millimeter, and her eyes are pearl, meaning they are her pupils are equal in size. They react to light. They are normal. Now we will move on, and I'm going to assess the nose. When I'm assessing the nose, I'm inspecting the nose, making sure it's in its midline position. It is straight and symmetrical of the head, and I'm also going to look at the patency. I'm going to assess the patency. I'm going to ask the patient. I'm looking the patient's nostril. No redness or bulging. Now, will you cover your right nostril? Olfactory nerve is cranial nerve 1, which will assess the patency of each nostril. Okay, and that's the left. All right, the right is patent. So there is no abnormalities with the nose. Now we're going to move on and assess the frontal and the maxillary sinuses, and I'm going to palpate them for masses and tenderness. Let me know if you feel anything, pain.
No.
That's the maxillary. And that's the frontal. Okay. Any pain?
No.
No pain or tenderness noted. Now we're going to move on and we're going to assess the throat. When assessing the throat, I'm expecting we're going to inspect the mouth and the throat. And when inspecting, we're going to start with the mouth. The mouth, we're looking at the lips and making sure that there are no dryness or cracks on the lips. The lips are well moist. Also, we're going to open the patient's mouth. And when opening the patient's mouth, you will look in the lower, raise your tongue up. Okay. You will look and down bottom, you will see the patient's soft palate, and the salivary ducts are very moist. And the buccal mucosa, it will be on the inside of the jaws, and they are no uh, sores noted. Also, we assess the gum line. It's pink and it's well moist. We assess the teeth. The teeth are in correct alignment and there are no cavities noted. We'll say all. Okay. And you assess the tonsils. The tonsils are the size 2 plus. Also, we will assess the hard palate, which is the top part of the mouth, and it is intact. No sores noted. Now we'll ask the patient to say ah and lift the tongue up. Okay, this is cranial nerve 9 and 10. I'm sorry. Mm-hmm. We're assessing the soft palate and the uvula and making sure that it's in a midline position, and it is in the uvula. Say all right, and it moves symmetrical. Is with phonation. Also, cranial nerve 11. I'm assess the tongue and 12. I'm sorry, and there's say all right. No fasciculations noted on the tongue. Moving right along, we're going to assess the throat. When assessing the throat, I'm going to start by assessing the trachea. It is in the midline position of the throat. I'm also going to assess this is the trachea. Then I'm going to move down to the thyroid. And then we're going to assess the tonsils. Tonsils on each side. All right. And there's no abnormalities noted. Now we're going to palpate the carotid arteries. And I'm going to assess turn the patient head, and I'm going to use 2 fingers, and I'm going to palpate the carotid artery, and you can feel it pulsating. No bruit noted. No lifts or heaves noted. All right, and that's good pulsation. Now I'm going to auscultate, and I'm going to use the bell and the stethoscope. And all right. All right, and that concludes the assessment of the throat. I'll move on to the posterior chest. When assessing the posterior chest, I'm looking for any obvious deformities and symmetrical expansion, chest expansion of the posterior chest. Say 99 for me.
99.
All right, and also assessing the tactile firmitis. When she say 99.
99.
And then I will percuss over the lung fields. Okay, and I will also take deep breaths in and out. All right, then I will perform egnophia. I will ask the patient to say 1, 2, 3 as I listen to this lung field.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
All right, now say 99, and we'll listen for bronchophia.
99. 99. 99. 99. 99. 99. 99.
All right, and whisper 1, 2, 3, and whisper pectoralicule.
1, 3.
All right, and then I will move on and assess the anterior chest. Anterior chest, I'm looking for symmetrical position of the chest and also in the obvious deformities. Breathe in and out for me. All right, and I'm checking out tactile firmitis. Say 99.
99.
Okay, now I'm going to auscultate. Take a deep breath in and out. All right. Take a deep breath. All right. Now I'm going to move on, and I'm going to I'm going to assess, when I'm assessing respiratory status, I also want to make sure that the patient has no nasal phlegm, is not slumped over in a tripod position, no cyanosis, no tachypnea, and no retractions are noted. Moving on right along to the heart. When I assess the heart, at first I'm going to listen to the aortic, which is second intercostal space, the pulmonic second intercostal space, the Erb's point third intercostal space, tricuspid valve is the fifth intercostal space, and the mitral valve is the fifth intercostal space. I will also auscultate those using the barrel of my stethoscope. Aortic second, pulmonic second, Erb's point third, tricuspid fifth, and mitral valve fifth. Also, I will assess for a PMI. I will inspect and auscultate. All right, then I will assess the radial pulse, and I will hold it for assess for at least 60 seconds, which is 1 minute, and meaning the pulse is greater than 60, and between less than 100. Check capillary refills. All right, less than 30 seconds, and the capillary refill is normal. Now I'm going to move on. I'm going to assess the abdomen. When looking at the abdomen, I'm looking for a contour and symmetrical color on both sides. There are no bruising, scars, or masses noted when palpating. First, we're going to palpate. Then I'm going to auscultate, starting in the left lower quad. And I'm going to percuss, listen for dullness, tymphania. All right, now I'm going to palpate for the liver and the spleen. Begin by assessing for the assessing the liver. I'm sorry, I pinched you. By in the left lower quad and working your way up. You don't want the liver to be more than 7 centimeters in size. Excuse me. And it's normal. Okay, spleen. You can actually feel it. Okay, and that you can feel the spleen, and it's feel normal in size. Now we're going to move on, and we're going to assess the arteries in the abdomen. Okay, I'm going to start by assessing the aortic, auscultating the iliac, the mitral, and the femoral. All right, and those are normal. Now we're going to move on, and I'm going to assess the lower extremity. When looking at the lower extremity, I'm making sure there's no dullness. I'm looking at the color, it's normal, and it's warm. The temperature is warm. Capillary refill on the toes are less than 3 seconds. And now we're going to move on, and we're going to perform range of motion. Okay. If you would please just stand up for me. Okay, we're going to do a little range of motion. When doing the range of motion, we're going to start with the hands, wrists, elbows, and shoulders. First, you can just repeat after me. We'll do a few steps. Okay. The hands, the fingers, we're going to spread them, which is abduction. Bring them back together is adduction. Bring them in towards the radial. Okay, and out towards the ulnar, which is alternation. Okay, now we're going to bring them down, which is flexion. Bring them straight out, which is extension. Now we're going to do range of motions of the wrist. Okay, the wrist, we're going to bring the hand straight down, which is flexion at a 45-degree angle, hyper extension. Okay, and we're going to circulate, circumduction. Okay, and now that's range of motion of the fingers and the wrist. Now we're going to do the elbows elbows here is flexion, straight out is extension, and slightly at a 45-degree angle, or either we can bring them back a little bit, which will give us also a 45-degree angle of the elbows will be hyperextension, okay? And of the shoulders, we will bring them in, internal rotation, bring them out towards our head, which would be external rotation, bring them in would be adduction, bringing them out would be abduction, okay? Now, when we're doing the shoulders also, now we will move on and do the feet, the ankles, the knees, and the hips, okay? We will begin by doing the feet. The toes will be plantar flexion and then dorsiflexion, okay? And then we bring your toes out, spread them out, okay? That will be abduction, and bring them in. Bring your toes in, close together is adduction, okay? And straight out is flexion, okay? Extension, I'm sorry, okay? Now we will bring our ankles in like, there will be internal rotation, which is inertion, and out is exertion, okay? Now we want to do the knees, and we're going to bring them back, slightly back, which is hyperextension. We will bring them out. They will be at a 90-degree angle, which will be flexion. Straight down is extension, okay? Bring them out, abduction, and in towards the body is adduction. Now with the hips, also with the hips, you will bring bring your legs out, which is abduction, I'm sorry, and bring your legs in, which is abduction. Okay, you can have a seat. Okay, now we're going to do the cerebral function, and we're going to check the finger to finger, and we're going to do this, the seer finger. Okay, just do this to your thumb to each finger. All right, and then you're going to take your hands and flip them over the hand flip. You're going to take them. Okay. All right. Now we're going to and then you're going to we're going to do finger to finger when we're pointing at my finger. Match my finger. Okay. All right, and then we're going to do I'm going to ask you to close your eyes and let me know if you can recognize what I'm putting in your hand, which would be stereognosis. Key. All right, if you can recognize, that's graphesthesia, I'm sorry, stereognosis, if you can recognize what I'm writing in your hand. A. All right, I'm going to ask you to stand up. All right, and we're going to perform the Romberg test by the patient, just closing their eyes for at least 5 seconds, or close your eyes and stand still without moving. All right, Romberg test is normal. Now we're going to assess your gait. Just walk a little bit for me. All right, gait is normal. Now I'm going to assess your strength in your arms and your biceps and triceps. Triceps. All right, bicep. All right, now I'm going to assess your in your strength, which is 5 and 5, in your hips. Try to bring your force. Yeah. Okay. Now bring it in. Okay. All right. 5 and 5. Now we're going to do the knees. All right. Push down against it. Okay. All right. Now we're going to stand up, and we're going to perform assess the spine. We're going to ask the patient to bend over. Okay, we're looking at the curvature. The spine, it is straight. It has a curve, meaning that it is in correct alignment with the body. Now we're going to see what I missed. Okay, I did the hips thing. Okay, and did I do the? Oh, let's do your strength of your shoulders. Shrug your shoulders on me. All right. When your shoulders are 5 and 5, strength is 5 and 5. Did you do your hands? The grip. Okay. Your hand. Okay. Strength is 5 and 5 in the wrist. Now I'm going to ask you to hop in one place. All right, and that'll complete our head to toe assessment. The patient is overall in normal status. Also, I forgot we're gonna do the reflexes, and then we will conclude. And this is the brachioradialis. You want to see a reflex in the patient, and this is the biceps. And then you ask the patient triceps, brachioradialis, the biceps, and then the triceps. And then we're going to assess the patella. Okay, and the Achilles. All right, and then I'm going to do the Babinski. All right, and then we'll conclude the head to toe assessment. Thank you.